Hi guys, welcome to my channel and learning together. I hope you all are doing fine. So I am posting this long video after a very long time. So in between I had posted some short videos. I hope you liked those. So and also my previous long videos which were about central line and ventilator series. So I hope you enjoyed those videos. It was helpful for you in your academics. So today we will be seeing one of the important topics about anticoagulants, as you can see in my current slide. So before starting this video, I want to tell you that if you like this video, please do subscribe and hit the bell icon for quick notifications. So this will be a long video. So this is about three different medicines, that is heparin, LMWH and warfarin. So in this first video, I will cover heparin, and in the subsequent videos, I will cover LMWH and warfarin. So let's begin. So coming to heparin, this man which you are seeing in the slide, so he is the man who discovered heparin. So heparin was first discovered by this man whose name was Maclean. He was a second year MBBS student. I don't know much about the history. I read it somewhere. So he was a second year MBBS student long back in 1916, and he only developed this warfarin. He extracted the warfarin from the liver of a dog. He did experiments on dogs, and in 1928 it first came in clinical use for humans. So as from this only the after that the heparin was used in the clinical side. So coming to a brief introduction about the drug heparin. So heparin is one minute. Heparin is a non-uniform mixture of straight chain mucopolysaccharides. So this is about all the chemistry about of heparin. That what is the molecular weight? It is around 10,000 to 20,000, and it carries a strong electronegative charge, and it is the strongest organic acid which is present in our body. So it is naturally present inside our body in human beings or in animals. So it occurs mainly in mast cells as a much bigger molecule whose molecular weight is around, naturally it is present in the mast cells with a molecular weight around 75,000, and it is loosely bound to the granular protein. Okay, so and it is present richly, densely in the lungs, liver, and the intestinal mucosa. Commercially, for clinical use, it is being produced from the ox lung or from the pig intestinal mucosas. Okay, so this is the organic structure of heparin. So this was about a brief introduction about the molecular weight, the structure, and also about the natural presence of heparin inside our bodies. Coming to the drug classification. So this video is about anticoagulants, and subsequent videos will also be of that. So anticoagulants can be broadly classified into parenteral and oral. Parenteral is direct through IV route that we can give, so which has either indirect or direct action. So the drugs which comes under the indirect action includes the unfractionated heparin, LMWH, that is low molecular weight heparin, fondaparinux. Okay, so this indirectly act in the coagulation cascade. Okay, the coagulation cascade I will show you in this means indirect action of these drugs occurs, whereas directly it can inhibit the thrombin, in which the examples are hirudin, bivalirudin, argatroban. So this acts directly on the thrombin, okay, coagulation factor. And another one is factor 10A inhibitors. Okay, this directly act on factor 10A. So which is example is otamixaben. Okay. Next is oral drugs which we take orally. So that includes indirect and direct. Okay, in indirect under indirect comes warfarin, that is vitamin K antagonist. Whereas in direct, there is thrombin inhibitors, which is dabigatran. Okay, and another one is the factor 10A inhibitors, which include rivaroxaban. Okay, so in factor 10A, rivaroxaban is there. So this is the whole classification about the anticoagulants. Next, coming to the mechanism of action of heparin. So how does heparin act? So I will show you the mechanism. Before that, I want to show you the coagulation cascade. How does it function, and where the heparin acts in the coagulation cascade, which results in its effects. So coming to this picture is more clear. So you can see, as we know, there are two pathways in the coagulation cascade. One is the intrinsic pathway, another one is the extrinsic pathway. And this is the common pathway. Okay. So in the intrinsic pathway, so as we know, there are 13 coagulation factors which are present. So this includes, uh, so when there is a damage to the body part, so both this pathways get activated. So you can see this activation of 12, then 11, 9, like this factors get activated, and in the extrinsic pathway, the seventh, okay, the seventh one is getting activated, and there is a tissue factor. That is when the tissue gets damaged, a factor is produced from there which activates the coagulation cascade in the extrinsic pathway. So these two together, they mm, activate the prothrombin, that is the second factor, into thrombin, that is 2A. A means activation of the factors. Okay, so for the activation of this prothrombin to thrombin, you need both the pathways, intrinsic as well as the extrinsic pathway is required. So, and then after that, in the common pathway, they act on fibrinogen to convert into fibrin, and then from fibrin, they form the fibrin clot. And in this side, you can see the protein S and protein C. So these are the negative feedback mechanisms that occur in this cascade as well. So coming to this antithrombin, this is the hero ingredient in which the heparin acts. Okay, so heparin acts in this antithrombin, this ingredient, this factor, protein. So how does it act? So physiologically, the action of antithrombin for the inhibition of this thrombin and factor 10, so it is present. Okay, it is present physiologically. But when the action of heparin occurs, then the action of this antithrombin, it means fastens up by around 1,000 times. Okay, so because of that, this thrombin and the factor, all these factors which are there, by which the action occurs in the coagulation cascade, that is, you can see this, the antithrombin inhibits the thrombin, and this thrombin has a positive feedback in all these factors. So thrombin activates factor 8, factor 11, this proteins, as well as the factor this 30. Okay, and also here in factor 5 also it acts for the conversion of 5 to 5A. So this antithrombin targets the thrombin, and this causes the inhibition of all these factors. Okay, so heparin acts in that way, and this causes the anticoagulation property in the blood. So in heparin, we mainly for while if you are giving heparin to the patient, we mainly monitor the APTT levels of the patient. Okay, APTT mainly covers the intrinsic pathway as well as the common pathway. So any increase in the APTT levels, normal is around 35 to 40 seconds. So any increase in this APTT levels means either we have to decrease the dose, increase or decrease the dose as per the levels of the APTT. So mainly when we are giving heparin to the patients, we expect the APTT levels to be 1.5 to 2 times the normal value. Okay, it will be increased. Okay, if it increases more than that, that means we have to reduce the dose of heparin. So this is the action by which the heparin comes into play through this coagulation cascade. Main action includes in the antithrombin. It acts on the antithrombin, which causes the this effects. I hope I was able to understand. I was able to explain to you about the mechanism of heparin. If you have any doubts, you can freely ask me in the comment section. I will be happy to answer those. Coming to other actions, apart from the anticoagulant action, heparin also has other actions. Like in higher doses, if you give, it can cause platelet aggregation and prolongs the bleeding time. Okay, bleeding time also gets prolonged and it acts on the platelets as well. So there is a term called heparin-induced thrombocytopenia. So heparin binds to platelets and it causes destruction of platelets, which leads to decrease in the platelet levels. So it is a rare condition, but it can happen in patients as well. So its other actions include like injection of heparin. It also clears the this one turbid postprandial lipemic plasma. Okay, clears turbid postprandial lipemic plasma. So after eating, our blood levels of means um, after eating, the lipemic lipid levels in our plasma increases. So it causes the release of the lipoprotein lipase, an enzyme from the blood vessels, which causes the hydrolysis of the triglycerides, okay, and the VLDL lipoproteins to free fatty acids. So then this free fatty acids passes into the tissues and the plasma gets clear. So this action also requires around a lower concentration of heparin, which is that is needed for than that needed for anticoagulation. So it is a, protective effect on the for the body. So apart from the anticoagulant action, these two actions you can also remember. Coming to the pharmacokinetics, so we mainly describe pharmacokinetics under three headings, that is absorption, distribution, metabolism, and excretion. Coming to the absorption of heparin, heparin is a large and a highly ionized molecule. So those molecules which are highly ionized, they can't be absorbed orally. So therefore, it needs to be either injected IV or through subcutaneously you can inject it. So if you are giving IV, so there is instantaneously it shows its action, means it is 100% bioavailability is there. But when you are giving it SC injection, the anticoagulant effect takes time. Obviously, it will, as we are giving in the fat tissues, it will go into the blood, take time for action. So its bioavailability is inconsistent. Okay. So in some cases we give IV, and in some cases like in DVT thromboprophylaxis, we mainly give through SC injections. Okay. So, or in cases of patients who are having kidney issues, CKD patients, or whose creatinine levels and urea levels are high. So in those patients also we prefer heparin over LMWH. And heparin does not cross the blood-brain barrier, so it is can be safely be used in case of pregnant ladies. Okay, so pregnant ladies we can use heparin instead of warfarin, because warfarin has fetal it has teratogenic effects, so it can cause damage to the fetus. So we mainly go for heparin even if it's needed in pregnancy. Coming to the metabolism, it is metabolized in the liver by the heparinase enzyme, and excretion, its fragments get excreted through the urine. Okay, so this was about the pharmacokinetics of the heparin. Coming to the dosage levels of heparin, heparin is conventionally given IV in bolus dose of around 5,000 to 10,000. Okay, 5,000 to 10,000 in case of children, around it is given, and followed by continuous infusion if it's needed. So heparin is used in cases of after surgeries like hip surgeries or any like knee replacement surgeries, hip replacement surgeries. Okay, it is needed. In DVT prophylaxis also it is needed apart from mechanical thromboprophylaxis. Then heparin is used in case of flap surgeries as well. So in flap surgeries, we don't want the flap to get damaged due to clot formation and all. So in those cases also, we either use heparin or continuous infusion of heparin is needed. In low dose regimen, 5,000 units or 2,500 to 5,000 units, it is injected SC every 8 to 12 hours in case of DVT prophylaxis, and started before in case of DVT prophylaxis also it can be used, or before surgeries, and continued for 7 to 10 days till the patient starts mobilizing. After the patient gets mobilized, we can stop heparin. And the regimen has been found to be prevent post-op DVT as well without increasing the surgical bleeding risks. Okay, so it is helpful. It also does not prolong the APTT or the clotting time, so it is safe for use. And this regimen is ineffective in case of high-risk situations like as hip or joint surgeries or pelvic surgeries. In those cases, you need a higher dose for the uh, to prevent the clot formation. Okay. So this is the vial of heparin. So heparin comes in two doses. One is 5,000 international units per 5 ml is there, or 25,000 international units per 5 ml also it is present. So you can see here it is written heparin sodium 5,000. So this is a 25,000 per 5 ml means 5,000 international units per ml. And it is derived from the porcine, that is pig intestinal mucosa, and benzyl alcohol is there, and water. So these are the ingredients in a heparin vial. Coming to the indications of thromboprophylaxis for selected patients in the ICUs. So in case of acute medical illness, either UFH or LMWH is used. So based upon the condition of the patients, we use major abdominal surgeries. Apart from LMWH, WH, chemical prophylaxis is given as well as mechanical, that is graded compression device stockings, or this in intermittent pneumatic compression devices also are given. In thoracic surgeries, cardiac surgeries, okay, all this both chemical and mechanical is given. In craniotomy surgeries, we mainly don't prefer to use this heparin or LMWH because it can cause the higher chances of this clot formation or sorry, bleeding chances are there. So we go for mechanical prophylaxis only. Hip or knee surgeries, LMWH, major traumas, head and spinal cord surgeries also, LMWH or LDUH is used, or IPCs. In case of ischemic strokes, okay, in strokes we don't prefer to give all this anticoagulants because it can cause high risk of means higher chances of clot formations may be there. But in those cases we start anticoagulants. Okay, so we anticoagulants means antiplatelet drugs like clopidogrel, aspirin we mainly use. So we don't need the this LMWH or heparin. In those cases, we can go for mechanical thromboprophylaxis even if it's needed. But if there is any chance for this cardioembolic strokes which are happening for atrial fibrillation, so in those cases we can use heparin. Okay, we can start heparin in those cases. And in case of any active bleeding or high risk bleeding, if it is there, we should not use LMWH or heparin. So pneumatic compression devices is the main choice for preventing DVTs. Contraindications like bleeding disorders, if any is there, then HIT, as I've told you, heparin-induced thrombocytopenia. Then severe hypertension, there is risk for cerebral hemorrhage. If hemorrhage occurs and over that you are giving heparin to the patient, so it can cause more bleeding in those cases. Then threatened abortions, piles, GI ulcers, subacute bacterial endocarditis, Okay, there is a risk for embolism is there. Then a large malignancies, risk of bleeding in central necrosed area of the tumor. Tuberculosis, risk for hemoptysis. Ocular and neurosurgeries, lumbar punctures, chronic alcoholics, cirrhosis, any liver disease or renal failure patients you should not give. Or if you are giving patients aspirin or other antiplatelet drugs, it should be cautiously used if heparin is needed also. Okay. Coming to the adverse effects, like it can cause bleeding, hypersensitivity reactions, thrombocytopenia, alopecia, osteoporosis, and hypoaldosteronism can also be other effects. Then other things like hematologic such as bleeding, thrombocytopenia, body as a whole, that is fever, chills, urticaria, means allergic reactions can occur. Endocrine such as osteoporosis, urogenital priapism, it is rare, it rarely it occurs. Skin, it can cause pain, itching, tissue irritation, okay. Pains in arms or legs, vasospasm can be there in some cases. Coming to drug interactions, it can act with other anticoagulant drugs. So it can it can have an additive effect of anticoagulation with other drugs, fibrinolytic drugs, antiplatelet drugs, fenofibrate. So if the patient is on all these drugs, always look that whether heparin is needed or not. If heparin you are giving, you should look for whether all these drugs are already being used in the patients, because it can cause either a decrease in the effects or increase in the effects. So this was all about heparin. So in my next video, I will be talking about LMWH and also difference between LMWH and heparin. So it will be easy for you to distinguish between the two. So if you have any doubt regarding this video, please feel free to ask questions in the comment section. And if you have any suggestions regarding the improvement of my videos, please do feel free to suggest me. So, okay, so have a good day and thank you for watching my video. And please do subscribe my channel and like and press the bell icon for quick notifications. And okay, thank you. Bye.